It's a diagnosis that every vet dreads and one that can take the life of a previously healthy puppy in a matter of days. But protecting your puppy from becoming infected or getting the treatment that they need to help them survive can be confusing, and fast action is absolutely critical. Hi, I'm Dr. Alex. I've been a vet since 2006, and in this video I'm going to break down everything you need to know about deadly parvovirus in dogs so that you can keep your puppy safe in the first place or help maximize their chance of making a full recovery if they do get struck down by this terrible infection. And to start with, we need to know what parvo actually is. So canine parvovirus, it's caused by a really highly contagious virus that only affects dogs. Cats suffer from their own version of this disease. It's a disease known as panleukopenia, but parvo is dog only. And while all dogs can be affected, can become infected, it's puppies that are most vulnerable and where fatalities are common, with older or more immunocompromised individuals also at a higher risk of suffering from more serious disease. And one of the challenges of parvovirus in dogs is that it can survive in the environment for long periods of time. This is important because parvo is primarily transmitted either through direct contact with infected feces or vomit or through environmental contamination. To start with though, this spread in diarrhea and vomit means that once one puppy in a litter is infected, all other puppies and dogs in that same environment will also quickly become exposed, with the potential for infection very high. And this means that it's unusual for only one puppy in a litter to develop parvovirus unless that exposure happens once they go to their forever home. And they're not safe once they're separated from their litter because dogs can contract the virus by coming into contact with contaminated objects such as food bowls, toys, or even shoes and clothing, further increasing the risk of exposure. The virus can also survive in the environment for a very long time. So it can survive on concrete surfaces for up to 9 months, and it's been reported to survive in soil for up to 9 years. That's a huge length of time, and it's going to depend on factors like temperature and humidity, direct sun exposure. But either way, this virus sticks around. And this means that once a property, a dog park or a neighborhood has had a puppy or a dog with parvo present, then eradicating the virus from the environment is incredibly challenging, near on impossible. And the risk of other unprotected dogs then becoming infected in the future is significant. So then which dogs are most at risk? Well, puppies between the ages of about 6 to 20 weeks are the most susceptible to catching parvo and then developing life-threatening illness. And this is because their immune systems are still developing, they're not fully formed, and the immunity that they receive from their mother is starting to wane. Their vaccine course is also going to be incomplete. Our black and tan puppy breeds such as Rottweilers and Dobermans may also be at a higher risk, as they often don't respond to vaccines until they are a little older. But then, while puppies often get the headline infection, older dogs can also become infected and very unwell. And that's especially the case if they've not been properly vaccinated or if they have a weakened immune system. And then for our adult dogs, even if they don't become unwell, they can also act to spread parvo infection to more vulnerable individuals by contaminating the soil of dog parks, for example. So what are you going to see if your dog does become infected with parvovirus? Well, symptoms generally start 3 to 7 days after exposure to parvo. And once an infection takes hold, the virus, it attacks the rapidly dividing cells in the body, particularly those in the gastrointestinal tract, the intestines, and the bone marrow, so the white blood cells, the body's immune system. And all this can lead to a real range of symptoms that include lethargy, loss of appetite, diarrhea, typically very, very bloody, like a strawberry jam, vomiting, dehydration, fever, weakness, weight loss, abdominal pain, depression, and of course all of these can then lead to death. Because make no mistake, parvovirus, it is an incredibly serious disease that is frequently fatal for a number of different reasons. But while foul-smelling bloody diarrhea is generally a hallmark of parvo in puppies and in older dogs, there are other causes of this, and so accurately diagnosing the problem in your dog is going to help guide their treatment. So to start with, if you suspect that your dog may have parvovirus, or if they've been in contact with another dog with this disease, it's really important to seek veterinary care immediately because time really is of the essence with this disease. And what's going to happen is your veterinarian is going to perform a physical examination, and they're going to likely recommend different testing. So that could be blood tests, fecal tests, and it might be imaging to make that diagnosis. So with parvo, a fecal test is the most common method to diagnose this disease. Either fresh feces is collected or a rectal swab is used to collect the sample, which is then tested for the presence of this virus. The great thing about this test is that it can often be run straight away in the vet clinic, giving an answer in a matter of minutes. Fecal testing is very accurate if a dog is unvaccinated, which is often the case with these parvovirus puppies especially. But unfortunately, a recent history of vaccination, even if the dog hasn't responded to that vaccine, can make the fecal test less reliable. And in a small subset of dogs with parvo, fecal testing may come back as negative, but thankfully that's pretty uncommon. If there's any doubt, or if that test isn't available, blood tests can also be used to detect the virus or antibodies to the virus in the bloodstream, as well as help to assess the health of the rest of the body to better target and monitor treatment. Imaging tests such as X-rays and ultrasound may be used to rule out other potential causes of your dog's diarrhea and their illness, or to assess the severity of infection and look for any potential complications. And then once a diagnosis is made, treatment needs to start straight away, and it is pretty intensive. And this intensive treatment can also make it rather expensive, running into the several thousands of dollars, which is another reason why taking measures to prevent this infection in the first place is the best approach, which I'll come to in just a minute. Now, regarding treatment, while historically there was no specific treatment for parvovirus in dogs, new highly targeted monoclonal antibody parvovirus treatment has recently become available in certain parts of the world. And what this treatment does is it binds to the virus and stops it from entering and destroying the cells that line the intestine. Now, while this is an expensive drug, it has been shown to significantly reduce hospitalization duration, so your dog isn't going to need to stay in the hospital for nearly as long. It's going to improve their speed of recovery, as well as dramatically reducing mortality, especially when it's administered early. Again, getting your dog in early is key. Now, in addition to this treatment, or if it's not available in your parts of the world, other symptomatic treatment measures are vital, and they're going to be implemented to support your puppy's body while also correcting and preventing complications. And these treatments may include some or all of the following. So intravenous fluids to correct and prevent dehydration, to sort out any salt imbalances within your dog's body. Antibiotics to treat secondary bacterial infections. So antibiotics, they're not treating the virus. Antibiotics are treating bacteria that take advantage of the destruction that parvo is causing. Anti-nausea medication to reduce vomiting, improve appetite. Pain medication, nutritional support. If we can feed these dogs, it makes a huge difference to their gut recovery. Intestinal support to limit the effects of viral damage. Microbiota restoration therapy to reset the microbiome, get all those good bugs, good bacteria thriving again. And in most cases of parvovirus, this intensive treatment needs to be carried out in the isolation ward of the veterinary clinic so that other patients aren't also at risk. And hospitalization typically is required for about 3 to 7 days. Now, that's a lot of treatment that's needed, but the good news is that while parvovirus is invariably fatal in puppies if it's left untreated, when caught early and with intensive treatment, over 80% of dogs can survive. And with this new antibody treatment, survival rates are likely to be even higher. Now though, rather than running this parvo gauntlet, let's switch to talking about how to keep your puppy safe in the first place. Because without doubt, the best way to prevent parvovirus in dogs is through appropriate vaccination. You know, vaccination, it's become rather a victim of its own success because in many areas, the uptake of vaccination has been so high that people are becoming less familiar with the devastating effects that parvovirus can have. And so vaccine rates then start to slide. And this is where outbreaks are then seen and puppies end up dying unnecessarily. This vaccine slide is then further compounded by vaccination disinformation and misinformation and scaremongering, which is becoming an increasing issue. In other parts of the world where vaccine intake is low, parvovirus, believe you me, is a constant and daily threat. So puppies, they should receive a series of vaccinations. We typically start that at 6 to 8 weeks of age, with a booster every 3 to 4 weeks until their final puppy vaccination at 16 weeks of age. Another booster vaccination is given at 6 months of age, before then switching to a 3-yearly vaccination schedule as laid out in the WSAVA, the World Small Animal Veterinary Association vaccine guidelines. Titer testing prior to vaccination is another option that can absolutely be considered. I've got other videos about those on the channel if you're interested. But just as importantly, along with vaccination, limiting your puppy's contact with unknown dogs and areas of high dog traffic is just as important while they are going through that initial vaccine program and until about 10 days or so after that final 16-week vaccination. And this means sticking to socialization with known dogs who are both healthy and fully vaccinated, while at the same time avoiding dog parks and other areas where people routinely exercise their dogs that you don't know, that you can't be certain of their health and vaccination status. Puppy classes are another great opportunity for your puppy to meet other puppies, to have a great time, for you to bond with them while also learning to love their vet clinic, which can make a huge difference to any future care they need to have. And I absolutely believe that socialization is just as important as vaccination, because one of the biggest causes of death and rehoming in young and middle-aged dogs is because of behavioral problems through a lack of socialization. So don't let that be the reality for your dog, and you can find out how to socialize your puppy properly by checking out this video. So tap on that video, get your puppy properly socialized, and until then, I'm veterinarian Dr. Alex. This is Our Pets Health, because they're family.